Hello everyone, my name is Yuexing Hao, a PhD student at Cornell University. I'm excited to share with you our CSCW 2023 poster paper, an exploratory study of shared decision-making, SDM, for older adult patients with chronic diseases. Imagine a 78-year-old male patient was diagnosed with long-term chronic illness. He and his family didn't have any medical background or sufficient health literacy. When he visited the clinics, his clinician gave him a treatment that his insurance didn't cover fully. He didn't understand the medical jargons and terms, and he didn't want the painful surgery at all. Medical knowledge has significant barriers. This is a true story from one of the study's interviewees. Patients with low health literacy or knowledge can have difficulty accessing healthcare and understanding their treatment plans. This difficulty has only increased in recent years with the increasing shift toward telehealth, with reduced patient-clinician contact times and with the impact of the COVID-19 pandemic and other stresses on the healthcare system. Shared decision-making, SDM, is an approach in which clinicians and patients discuss the best available evidence for decision-making and incorporate the patient's preferences into treatment decisions. The SDM process entails the professional providing the patient with information about the decision, presenting various options, and eliciting a discussion about the patient's goals and preferences before ultimately establishing a treatment plan. In the current exploratory study, we conducted one-on-one interviews with older adult patients and clinicians to better understand their needs as related to the SDM process. The main research question evaluated in the interviews was, how can the SDM become more efficient and effective for integrating older adult patients' preferences into treatment decisions? The answers to this question can potentially lay the groundwork for the future development of technological tools to aid in SDM activities. In this study, we conducted 12 IRB-approved, semi-structured, one-on-one interviews with 7 older adult patients, mean age 72. The interviews with older adult patients were divided into 5 question categories, including demographics and basic health information, previous SDM experiences, health literacy, perspectives on health outcomes, and design recommendations for SDM technologies. We also interviewed 5 clinicians, means years of practice 12, to understand their needs in the clinical decision-making process. The interviews with clinician participants were divided into 3 categories: clinical domains and experience, previous SDM experiences, and design recommendations for SDM technologies. Combining the interview results from the older adult patients and the clinicians, we identified 10 factors that the participants believed were important to include when presenting information about treatment options to patients. To design an SDM platform, there are 3 major obstacles we'll need to overcome: variability in patient situation and chronic disease characteristics, engaging patients in SDM, and time limitations in clinical care. This work is a collaboration within Cornell University with Zeyu, Dr. Monika Safford, Dr. Rulla Tamimi, and Dr. Saleh Kalantari. This older male patient could be our grandparents or parents. From a long-term perspective, it will improve the patient health outcomes and directly impact our beloved family members and possibly one day you and me. Thank you for listening.